In terms of lipids, familial hypercholesterolemia is a particular area that we really don't do very well at identifying in the United Kingdom. Patients with familial hypercholesterolemia have a hugely increased risk of having a heart attack or a stroke. We should be thinking FH if our patients have a total cholesterol of 7.5 or an LDL of greater than 4.9, and asking questions about whether they have a significant premature family history of ischemic heart disease. So if they have family members under the age of 60 who've had a heart attack, who've developed coronary artery disease, then we should be considering familial hypercholesterolemia. And in that context, we should be referring these patients for assessment to a specialist FH lipid clinic. Traditionally, how we've identified family members with familial hypercholesterolemia is when we've had what we've called an index case. That is, if a patient has had a heart attack or a stroke, they're identified as having FH, then they are referred to the FH screening service, where they build up a family tree and they identify patients for cascade screening. So that patient's relatives will then be offered a genetic test to identify FH. One of the issues with that is that if the patient is in their 60s, their family members may be in their 30s, 40s, and they have FH, they will already have a big cholesterol or LDL burden and be well on their way to developing cardiovascular disease. So a very novel way of identifying patients is the child-adult screening program, which is being piloted across many GP practices across the UK, including in the northeast and North Cumbria, and my own practice has been participating in that. And what we mean by that is that children at the age of 12 months coming for their vaccines are offered a test to check their cholesterol. If that's above a defined level, then they're also offered a test for genetic screening of FH, and that is sent off. This, to my mind, has huge advantages, because if we can identify families far earlier, manage their FH with lifestyle, dietary advice, and potentially lipid-lowering therapies, we then reduce the chances of them having a cardiovascular event, often at an early age, which can happen in patients with familial hypercholesterolemia.